welcome back to Rorik Knows Podcast, helping you become a better and more informed you. So this is the Dr. R series, Ask Dr. R. And I do these intermittently to talk about questions I get on my social media and also from my office and my patients when they come in and see me. And let's just start with the first one. Is it hurtful or harmful to start injectables or toxins or fillers at an early age, such as 18 or younger? And what are the long-term side effects? Actually, great question. A great question, because this whole thing about prejuvenation has really hit the social media hard. And, initially I was thinking, this is crazy. But I think that there is some science to early prejuvenation, and especially for skincare. Sunscreen is definitely important for everyone. Now, do they need to go and do full-bore retinol and vitamin C when you're a teenager? Probably not. Sunscreen is probably the most rejuvenative thing to do to prevent you to have sun damage. Now, what about things like neuromodulators or fillers? I would say that doing them early is really not perhaps the most prudent thing to do. I would say that definitely not fillers, because we're seeing that all the time, with some of the influencers out there where they're just putting in, they're doing fillers, they're doing lip fillers, and it looks bad. And I think that's the worst thing you can do, is to make someone that's young, make them look weird or different. Now, neuromodulators, I would tell you that if you have early or premature forehead lines, especially when you animate, I think microtox or low level of neuromodulators does make sense. Even in the teenage years, when you're doing it very prudently. And I think that can actually soften and maybe even minimize your aging, especially in your forehead area. So I think that's a great, great question. And I think you should do that. But by and large, it's the use of sunscreen and just practicing, sun avoidance, and really doing all those things. Moisturizers are very useful in a youthful patient. But to do in full bore with fillers in the teenage years, I think, is really challenging. So I would say that's no. Well, here's another great question. What does an over-injected face actually look like, and why does it age a patient? That's great. Well, over-injecting a patient makes them look odd, the pillow face, and it really makes people not only look odd, but they look older. There's nothing worse than seeing somebody who's like 50 who's over-injected cheeks and lips, and I see it all the time. And I'm melting this a lot, especially in my pre-facelift patients. They come in and they've been over-injected in their cheeks and their lips, so I have to melt that with a hyaluronidase, which partially melts some of the fat or some of the filler. Usually it's a hyaluronic acid filler, so it really makes you look abnormal. The key with any great injection is that it doesn't look like it's full. It looks like it's natural, and that's what people don't get. So cut out all the social media stuff, all of the Kardashian things about the face and the over-injected. It just looks weird. If it looks weird, don't do it. Okay? Just don't do it. And then I think that's a great, great question. And then here's another great one is, I know protecting our face and skin from the sun is key, but what are some key tips for protecting our hands? Also a great question, because so many times when I'm doing a facelift, I also do something with their hands. And really, the best thing to do to protect your hands is use sunscreen there. And the other thing is, as we age, we lose fat in our hands, just like in our face. So often, when I'm doing a facial rejuvenation, I'm doing fat with the facelift, I also inject the hands. And that's been a topic of another podcast, which I'd love you to look at and talk about hand rejuvenation. It's really, really important. And adding fat is the best way to rejuvenate the hands. And then using sunscreen in that area. And then you can do things like intense pulse light treatments to get rid of brown spots or red spots, and that'll really, really help rejuvenate them. So that's a very, very important part. It's almost as important as protecting your face from the sun, using a sunscreen in that area. So it's great. Well, here's another one. So if I'm scheduled for a facelift, what's the ideal time frame to stop using injectables? Okay, and then should fillers be dissolved prior to a facelift? Well, if you're having a facelift, the ideal time to stop having injectables is at least 6 months before. And also stop the Botox if you can for at least 3 months before, if possible. But definitely fillers, stop at 6 or 9 months before. And then always come see me, or if many of my patients are from out of town or out of the country, I would love to see you, at least a week or so before, so I could inject them and dissolve them. And even the day before would even be much more helpful. Like today, I dissolved somebody's fillers in their cheeks and their lips because I'm doing their face tomorrow. Because it really, most of the dissolution with the hyaluronidase can happen in 24 hours. So it's really important to do that because it really makes your whole face look better if you've taken out a lot of your fillers, especially in your lips and chin. That's really important. In your cheeks, you can do it, but many times I'll just remove it during surgery. So very good question, and I see this all the time. So, and then here's something that's, what procedures do you find trending in 2025 so far? The biggest thing I find trending is the invisible look. And this was one of my topics of an earlier podcast where I actually talked about what's the most important things you're going to see, and that's the invisible, which means things done well, things done naturally. So the natural look in the fillers, the lips, the facelift, and get rid of all of the crazy stuff that people are talking about that look weird, because people don't want to look weird. They want to look natural. They want to go to parties or receptions and have people just say, wow, you look amazing, versus, oh, did you have a facelift? That's terrible. Or did you have a rhinoplasty? So what's trending today is the natural, youthful look. And even at the recent Oscars, I saw people looked more natural and not weird. Even the Kardashians looked more natural. Shocking. They're influencers and trendsetters. So lasers, okay, it is the laser season, it's during the winter months, and so what can patients do to prolong their results as the warm weather comes and sun exposure is increased? Well, I think skin conditioning and the laser season should be 24/7. It should be year-round. You should protect your face, your skin, by the cardinals of skincare, which are really, I think, threefold, which is sunscreen, the use of an antioxidant like vitamin C, and then I would use an exosome, which is a precursor for stem cells, which helps to promote skin wellness, hydration, and helps to blend the skin, make it look more smooth and natural, and really give it a rejuvenative look. You can use toners and moisturizers, but they're not as important as those top three things. And the laser season should be all year round. You should protect your skin and your face 24/7 with great skincare, like Pavis, which acts for 12 hours and has so many other things that actually moisturize the skin, polypeptides that actually nourish it and make the skin look better longer. So that's what I would say. The laser season for your skin should be all the time. Okay, I want a breast augmentation in time for the summer. What's the ideal time to do this procedure? So I'm healed and able to swim. Okay, so the ideal time to do it is usually about 6 to 8 weeks before the summer at the latest. But if you're going to go swimming in the ocean or a pool, I'd say 6 to 8 weeks at least. In lakes, especially Texas lakes, I would say 2-3 months if you're going to swim in a lake at all in Texas. So the key is you want to be perfectly healed so you can not only enjoy the summer, but so you can also do emotion like swimming and doing all those things that you enjoy. So the time is really when you're going to be ready to get into your summer swimsuit, which is usually 6 to 8 weeks before you're going to need to enjoy it. And of course, always use sunscreen, and then also protect your incision site, which usually is in the inframammary fold, with a silicone gel or with a moisturizing cream. All of those are available from your plastic surgeon. Those are very important things as you get ready for summer. So, and then finally, what do you need to know before you have a facelift? Great question. Well, I think first and foremost, you need to do your homework. You need to find a board-certified plastic surgeon or a facial plastic surgeon that's really an expert in facial rejuvenation, that has expertise, experience, and can show exceptional results. The 3 E's. Those are very important. And then know what you want. Tell them to hear what are the 3 things that bother you. Is it your jowls? Is it your neck? And are you ready? And if you have jowling and neck bands and you're feeling like your eyes are looking really old, you're probably ready for a facelift. And the moment you have jowls, stop doing fillers. I think that just portends you for getting a pillow face if you keep injecting and trying to correct jowls. So find your surgeon. That's the most important thing. Find somebody who's open, who's honest, who's going to give you the facts about what you should and shouldn't do, and shouldn't sell you things, but should be educational and informative. Those are the most important things you can do. So hopefully these questions, which were all excellent from my viewers, will help you become a better and more informed you. And so until next time, please ask Dr. R, give me your comments and thoughts, and stay safe out there and helping you become a better you.